My name is Barbara Cooper. I am a student at the University of Maryland Global Campus in the summer term of 2020. This project is Assignment 9.1 done as a time series story in Tableau for Professor Carrie Beam. Why is there so much coverage of COVID-19? Is this virus something to fear, or are the numbers exaggerated? Should we take extra precautions as we go about our lives, and will it help us stay healthy? What are the predictions for upcoming months? Will this virus flatten out and go away, or are we stuck with it and the risks that it brings? Where in the world is COVID-19? Everywhere. In Figure 1, you can see that the United States is at a global high of 3.7 million cases as of July 13, 2020, with over 140,000 deaths. Brazil is in the middle of the pack in yellow with just over a million cases, and in South Africa, they are among the lowest number of cases to date, with just over 350,000 cases. This map shows how COVID-19 has infected nearly every single country in the world. So what are governments doing to protect us, and which countries are implementing stricter measures to protect its citizens? Figure 2 shows the Government Response Stringency Index, which factors in indicators from countries including school closures, restrictions in going out in public, economic policies to help people financially during the crisis, and health system policies such as access and requirements regarding testing the public for the virus. The scale for this ranges from 0 to 100, with 100 being the strictest. As you can see, the index value for both France and Italy was over 90, meaning they implemented strict measures as a response to the outbreak, and there's much smaller numbers as a result, with France reporting 172,377 cases, and Italy had 242,827 cases. If you look at the U.S. in contrast, we have the highest number of cases with over 2.8 million, and the lowest index of the countries on the graph was 73. This graph shows that following the guidelines set out by the CDC helps to protect everyone. How many people are getting sick enough to need to go to the hospital? Figure 3 shows hospital beds available per 1,000 by country. This measure is an overall indicator of how many hospital resources might be available to people with serious illnesses that require the constant care provided by hospital providers. If not enough beds are available, then it is more likely that contagious diseases will spread, since people don't have adequate access to doctors, and the mortality will go up. Figure 4 shows the population by country with basic hand washing facilities on premise as collected by the UN Statistics Division. The UN has promoted good hygiene as an important method to contain the spread of infectious diseases, including COVID-19. According to the UN, providing more access to hand washing settings in places like hospitals will reduce the number of infections and improve mortality rates. Proper facilities include private bathrooms with clean running water and sinks and soap. The dark blue areas are countries with more access to hand washing stations, whereas darker green countries do not have easy access to practice good hygiene. An example is Egypt in dark blue, who reports 89% of the population have good access to wash their hands, where Bolivia is reporting 25%. The forecast is concerning for the foreseeable future, as the number of new cases is predicted to continue to rise globally, and the number of new tests administered will continue to rise as well. But the forecast is predicting that the number of people dying from COVID-19 will level off in the next 3 months. Based upon this analysis, cases are going to continue to rise, which means fewer hospital beds for the sick, and the number of deaths will go up in the next few months. Things that we can do to help flatten the curve of people who catch the virus is to practice good hygiene by washing hands frequently and wearing masks. The CDC maintains practicing social distancing by keeping 6 feet apart from others not in your household limits exposure. Governments around the world have implemented varying degrees of business closures and school closures to help reduce the number of people who get sick. This is a global pandemic. It's only going to get worse before it gets better. So following the guidelines from experts by the CDC is our best chance to stay healthy.